morning. On a Sunday morning, everybody here. Nice to see so many people here. I'd like to thank Prof. Lin for the kind introduction. So first of all, I learned quite a lot about childhood cancers today and the challenges they face. And we now go into adult side on colorectal cancers. So as you all know, colorectal cancer is now a challenge. And just that diagram, I just wanted to see that 6 foot of large intestine and about 6 inches of rectum. Just remember that. That's where the problem comes. So if you, just to go a few slides on our cancer trends, if you take worldwide statistics, the incidence, lung cancer still #1 in the world, breast cancer, colorectal cancer, prostate cancer, stomach cancer. In some countries, prostate cancer is going up. Breast cancer, as you know, more in females. This thing. So that's for the whole world, male and females. But if you look at mortality, number of people dying, so the lung cancer seems to kill more people. Colorectal, not so bad. Breast, at least better survivors. Stomach, not so good. So these are the typical cancers. Now, if you take the world as a whole, you look at the colorectal cancer age standardized rate, you say, look at Brunei, I put it in red there, 34.9, Singapore 36.8, Australia 36.9, so we got a big problem here. Indonesia 12.1, not sure, not bad. Either they are not affected so badly or underreporting, or I'm not sure. But Brunei and Singapore, maybe our food, I don't know. Malaysia, I didn't mention that. Okay, so I'm talking about Brunei first, cancer burden. Cancer is our #1 killer now. Used to be cardiac diseases, but now cancer has overtaken. And if you look at men, the top 3 cancers are colorectal, lung, and prostate. So colorectal #1 in men. It used to be lung. Now it's colorectal. And women, still breast. Colorectal also has jumped up, and cervical cancer. So both sides, colorectal is high up now. So that's why I was going to talk a bit more colorectal. But if you look at Brunei cancer, this thing for population of about 433,000, you have number of cancer cases, and if you look at this side, the incidence, breast cancer still high, colorectal. So these 2 are the main cancers. Lung a bit better now because they have stopped cigarettes sales and all these things. But death rate high, breast still good survival, colorectal still not so good. But these are the other cancers. Temporarily what you can see is that every year, although a small population, cancer cases are going up in Brunei. It's going uptrend still. And the problem is, our biggest is, that's why I'm talking about this challenge. 70% are still diagnosed as stage 3 and stage 4. It's not just colorectal, but all the cancers, even breast, this, that, all stage 3, stage 4. Even though in Brunei treatment is free, accessibility is a bit better, but still something is wrong. Why are they coming so late? And still stage 3 and 70%. And so this is why it's so important that early screening, detection, public awareness, talks like this, raising awareness, all these cancer congresses, trying to raise awareness, go out, see what are the problems. Access to care is there, but why are patients not going? Is there phobia? People have that phobia, they have that. First problem is denial that they have the cancer. They have a lump there, they don't want to go and say, oh, it must be normal, it's not having pain. I'm having some blood in the stools, or maybe it's just was there, the piles or something like that. Maybe I ate something wrong, that's why I ate something spicy, that's why I passed some blood. Or maybe tomorrow no blood, so okay, I'm okay, back to work, not bothered. But that's your first danger sign, red flag sign, but you didn't follow. And especially with young people, they're not even bothered. Hey, something, I must have eaten something wrong. I ate chili padi or I ate nasi lemak, maybe too hot. So this is one case I see a lot of these cases in my daily clinical practice. There's a lady who's about 45 years old, presented with constipation, some blood in the stools, and you see the patient has got advanced tumor. And this huge tumor is sitting there in the rectum, and it is affecting it has invaded the bladder and is invaded into the vaginal port also. So it's a very unfortunate, so bad the disease. As you said, many of these cases are stage 3, stage 4 disease. So we did a PET scan also, and as you can see, high uptake, they're teaching that it's huge tumor. Can't believe it. But they are presenting so late in this therapy. And luckily there was no disease elsewhere, but very likely there may be cells outside, but not picked up on the scan. But just to show you that we see this so commonly, this was just one of the cases. And I've seen a 32-year-old lady presenting with CA rectum. A 32-year-old lady will never think of having CA rectum. But she presented with PR bleeding, and initially she didn't observe it. Then after that, she had symptoms further, she went, 32-year-old lady. 32-year-old ladies will never think of cancer. They say, cannot be. So if you look at the statistics in our place, maybe it's a busy slide, but if you see age, the commonest age is obviously still 50 to 90. So if you take this 50 to 90, that's mostly all that. But you see that 31 to 49 is coming up to nearly 20%. So that's the young age group. This is the worrying trend now, because people always think that cancer must be above 50, is the old age group. But young people can get cancer. That's why I said we have to raise the awareness that young people can still get cancer. And when you hear the childhood cancers, this one is getting a 32-year-old, 30 years old, and this is their prime of age, their working life, they are, family, this, that, they'll never think of cancer. That's the thing. So nearly 20% still there. So that's the worrying trend, younger generation getting it. So what are the causes? I'm talking more about colorectal cancer. That is my topic on. So usually what are the causes of cancer? Sporadic. Most of them is, no definite cause. But then there's a familial thing caused by environment and genetic, 10 to 30%. So if you have a strong family history, you have family members having it, your parents have cancer or your uncles, then you're a bit worried there's a familial trend. And there is a small group, 5%, which are hereditary. These are usually due to a single gene mutation and everything. So if you look at this, majority are sporadic. Then there's this familial group. Then the smaller group, which like one of these is the Lynch syndrome. And there is the familial adenomatous polyposis, is less than 1%. And these people have thousands of polyps in their gut. And you don't know which one will turn cancer, but they are high risk of turning cancer. The other one is this group. So they are small groups, but this familial one is still a reasonably big group, and the other one is sporadic. So generally for cancers, we always say what are the causes, this, that, and everything. So mostly, obviously, a small percentage, 5 to 10% are genetic, genes-related mutations, but most of it is environment. And we all say what is the cause in the environment, what is cause, what is changed over the years, over the past 40, 50 years, what has it changed? Obviously, diet is a big problem now. 30 to 40% of generally all cancers are caused by diet. And obviously, the preserved food, the red meat intake, the high fat intake, and all these things are the preserved food. And there is a lot of preserved food with a lot of processed food is another problem. Barbecues, this, that, and all these type of things. All these are the biggest culprit. And we all, many of the children go to Kentucky Fried Chicken, McDonald's, and all these things. This is their favorite food. And they somehow do very well in these businesses. You go any part of the world, McDonald's people know, Kentucky Fried they know, and they know everything. Tobacco is another big culprit. So, obesity. So, these are the two or three main things. Infection, some of the cancers are related to infection, especially ACC and all. So if you look at risk factors for colorectal, this is for a mixed audience, so I'll just go through. Age older than 50, obviously, is one of the risk factors. Colon polyps, okay. These polyps are the one which I'll say a few words later. Inflammatory bowel disease, not so common. People with ulcerative colitis, people with Crohn's disease have a higher risk of colon cancer. Not so common, but you have to think about this. People who have this, you have to follow them up carefully. Inherited syndromes, I mentioned. family history I mentioned, and then people nowadays eat less fiber in their diet and high fat diet. So this is another big problem. Our fiber intake has gone down compared to the previous years. And this is another big problem. We all become sedentary lifestyle. We have more diabetics, obesity, big culprit. Smoking and alcohol is another big culprit. And if you had previous history of radiation treatment, especially like those who had childhood cancers, who had radiotherapy and all these things, there was slightly higher increase. Not so common, but the biggest culprits are here: smoking, alcohol, obesity, sedentary. These are the big culprits. And just one slide on this Lynch syndrome, which is very important because this is a hereditary cancer, and some of the stains we can do on the tissue. If you have MMR positive and they have that, then they have a high risk of cancer, colon cancer, and they usually not only have colon cancer, if they are females, they also get endometrial cancer, prostate cancer, they also get biliary cancers, pancreas, and all these different cancers. So they have a high risk of going down. But you have to pick them up early. And these are our common symptoms many of them present with: bowel change, blood in the stools, abdominal discomfort, weakness, weight loss. Some of my patients, like this, 10 kilos they have lost over 3 months. Something is going wrong. Stools, like thread coming out, that means there's something blocking. And this one of the biggest problems, polyps. You see, unfortunately, unless you do colonoscopies and do these things, you can pick up polyps. These polyps start off as just hyperproliferation. They are initially benign, they are called benign polyps. Then they get dysplasia, there's some abnormal change in the cells. Then they become adenocarcinomas and invasive carcinoma. This whole thing may take about 10-15 years. So you actually have a chance to pick up this and cure them. You see, you can pick up these polyps early. You see. So this is where it's not like 2 months or something like that. Over 10-15 years it's been going on in your gut. Unfortunately, we are not picking it up. So if you look at these cancers in these different parts of colon, I told you 6 feet and 6 inches. So rectum, that's 6 inches, they got 14%. And if you take this plus this, sigmoid plus this, you nearly got 50% there. So 50% of your, this thing is, cancers are this area, and there's another 22% here. So when you say colorectal, it consists of colon and rectum. But there are slightly some differences between them. Colon cancer tends to be more common in both genders, equally common. This one seems to be more common in men, but tends to spread more easily, and tends to spread sometimes to the lung, this, that, and everything early. And more difficult to cure, because if you have colon cancer, you can resect part of the colon, but rectum, smaller area, you may end up with a colostomy and all these things. More difficult to cure. They tend to spread locally, whereas their symptoms, there are slightly different symptoms. Risk factors are different. So from colon cancer, it's a bit easier for the surgeon to treat. This part is more difficult to rectum. So most important, what I'm trying to emphasize is this important, because we are picking up late. Somehow, if we can do early, regular screening, removal of these polyps, because you can imagine they're 10 to 15 years before these polyps go into cancer. You can pick them polyps early, you have actually prevented the cancer. Early diagnosis is a treatment success. So screening to begin at the average risk people, at the age of 50 years, black people tend to higher, but if you have a strong family history of all this, you have to do earlier. Next slide. So the usual screening for colorectal is the fecal test, because it's cheaper to do and this thing. And the other one is obviously the gold standard is to do colonoscopy. Then you can do a full this thing and you can check properly, and if you've got polyps, you can take it out. So in Brunei, we have a national screening program, and it covers colon cancer, cervical cancer, and also breast cancer. These 3 cancers are this thing. So in the standard one, at the age of 50 to 75 years, we can go for this stool test. But if you have a family history, this one, if you have a strong family history, that, you can go, many of these like this people, they can go even 10 years since, if you have your brother or somebody who has got cancer and they develop cancer at the age of 50, you go for screening at the age of 40, 10 years before that. So you can do that and pick up early and treat them early, you see. So that's why I said this just now, the earlier slide, this process takes about 10, 15 years. Normal hyperproliferation, early adenoma, there are mutations that take place in the process and they develop cancer. And once they develop cancer, you have early stage, stage 0, stage 1, they have gone through the wall, stage 2 is almost touching this thing, stage 3, the surrounding area, stage 4, the disease has gone out. You want to pick them up at stage 1 or stage 0 or stage 2 maximum, but most of the people we are getting are stage 3 and stage 4. That's very unfortunate. And colonoscopy, if you do, you can do a lot of things. You can examine the whole system, you can see the polyps, you can take the biopsies, and you can prove that. But it's a bit more difficult. You must have a lot more gastroenterologists, you must have scopes available. These are the challenges the government. Okay, 1 minute left. Okay, we're almost there. And so the interesting thing is almost half of these cancers can be prevented. Healthy lifestyle, fiber rich, limit red meat, limit alcohol. So that's good news. But we are not following it, that's the problem. And once you make the diagnosis, you have the biopsy of the lesion, you do scans, histology, surgery. I'm not dealing with all this because this is all in our territory, but I wanted to speak more about early detection. And once you have the cancer, you want to stage it, tumor size, any lymph nodes affected, as it spread to other areas. And as I said just now, unfortunately, stage 3, stage 4, you see nearly 70%. Stage 1, 15% only. Stage 2, 20. And as you said, if you have stage 2 disease, your prognosis drops from 93%, you go down to 8%. I think that's all. Have I time?